Why is mom having nipple pain and how can we help her? Pain with breastfeeding is not considered normal. It is, however, very common. So, one of the things I hear most from patients is that it's really frustrating to tell someone that they are having nipple pain and have it be disregarded. Have over and over again have staff say, "Oh, the latch looks good, so it must be okay." So keep that in mind as you talk to patients. Just like with all things, try to help definitely take in what they're saying as part of your assessment, because it matters. So let's talk a little bit how we can help these patients. The most likely reason their nipples hurt is because of a shallow latch. The baby is not on the breast far enough. If the latch looks okay, but it's still hurting mom, it's not okay. There's something off there that we need to dig into and try to figure out. The fix might be really simple. It might be turning baby's bottom so that their ears and their shoulders and their hips are all lined up. It might be moving them towards their toes a little bit so that they can get on further. It might be moving baby's hand so that it's on the other side of the breast, so baby's kind of even as they're latching on instead of being turned. If mom has pain that goes away after the initial latch, it might be due to trauma from a previous latch. So that could be a good sign that all of her latches aren't shallow, but she just had one that caused some breakdown to her nipple. And latches after that are going to hurt a bit until that heals. But if the pain is lasting throughout the whole feeding, either it's that latch that's shallow or her nipple trauma is a lot worse. And if the pain is getting worse from feeding to feeding to feeding, then the right corrections aren't being made yet. There is a handout in postpartum in the lactation drawer called Nipple and Breast Care. This is a great one to hand to moms or to dads, so that they can have a reference after you've helped them address their pain. So, what can we do to help this mama have less pain as she's breastfeeding? Lots of skin to skin holding. That's the first thing. It's almost always the first thing that you do to fix a breastfeeding problem or to prevent a breastfeeding problem. So as much skin to skin holding as she can handle. With feedings, for sure, take baby's clothes off and put baby skin to skin with mom for feedings if she's having breast pain. And also in between as many feedings as she can handle. This is baby's most normal environment. It's going to help baby bring out more of their natural instincts that they had right after birth to help them latch deeply. It's going to help for a lot of reasons. So as much skin to skin holding as she can handle. Take baby's mittens off. Babies use their hands a lot with breastfeeding. I heard a really interesting hour-long conference talk one time all about baby's hands. And there's some interesting research about them, but they use them purposefully. Now, they might be clumsy and they might feel like they're in the way, but they're trying to use them. So I know there are sometimes exceptions to this where baby is too upset to latch any other way, for example. But your main go-to with baby's hands should be where they have them out on either side of the breast and they get to use them as they find their way to the breast and latch onto the breast. That should be the most typical thing that you do with their hands. So encourage the parents to let baby have their mittens off and their hands free so that they can get better at this feeding thing they're trying to learn. All right, so before feedings, one of the first things you can do to help decrease the nipple pain a mom is feeling is to put a warm compress on her breast. Have her put a warm compress on her breast. My favorite are the little circular ones that can go in the freezer or the microwave. Sometimes they're called like boo-boo things because they're for little kids, but they're the perfect size to fit in a bra. And they have a little like fluffy cover on them, so mom can kind of decide how cold she wants it or how warm she wants it. whether she uses the cover or not, that sort of thing. So those are a great option. Otherwise, it can just be, a warm washcloth. That's going to cool down a lot faster than a warm compress that was warmed up in the microwave, but it will still do the job for short term. So warm compress before feedings is going to help the milk come faster, which means that baby has to suckle less intensely for a shorter amount of time, because the milk's going to come easier, because the milk is more ready. And sometimes those initial suckles, when baby's trying to get the milk to come down to the nipple, can be the most intense for the mom if she's having pain. So warm compress before feedings. Obviously a deep latch. So go back to that video on how to latch a baby deeply and check out all the tips there with latching this baby deeply. Then after the feeding, have mom express milk onto her nipples. This is going to help heal any cracks or breakdown that she has in the nipple, but it's going to dry really fast. So it's not going to protect from her bra or her shirt or anything that's going to rub up against her nipple and cause more irritation and pain before the next feeding or with that next initial latch. So after expressing breast milk onto her nipples, covering it up with a thicker nipple cream is a great idea. So this could be a lanolin cream that we have in the Pyxis. It could be a non-lanolin cream that she brought from home. The idea is that it's thick and it's going to, one, provide a wet environment where her nipples don't dry out and create scabs that then baby's gonna pull off the scab when they go to nurse next. And it also will protect from anything that's gonna rub up against her nipple, like her bra or her shirt or the towel when she is drying off. And then after that, she can apply a cool compress. So this could be that same little circular microwave freezer pack. It could be a Soothes gel pad. The Soothes gel pads she can use at room temperature. They're going to be cool by themselves just because of the gel, or she can put them in the refrigerator to cool it even more, depending on how cold she likes it to feel. So that cold is going to help her with the pain following the breastfeeding. So there's a lot of things like that, heat and cold, heat before, cold after, that can buy her time while she's working on getting consistent deep latches. It can make things more comfortable in the meantime. In the end, it's the consistent deep latch that's going to make the pain totally go away. Avoiding soap right on her nipples is helpful. She can just avoid soap on her breasts in general. It can sometimes change the scent of her breast, making it hard for baby to latch on, but it also dries out her nipples more, which can make things more sensitive. So after the shower, where she just lets the water run on her breasts and nipples and doesn't apply any soap, with the water alone, it's going to dry out her skin more. So after the shower, same thing with like after breastfeeding, she can express milk onto her nipples and then cover it with a thicker nipple cream. Encourage her to keep asking for help and for help assessing the breastfeedings. This isn't something that we want them to go home and just figure out on their own and deal with on their own. We'll talk about why in a minute. Encourage them to watch Attaching Your Baby at the Breast on globalhealthmedia.org. That website is on the handout that I showed you at the beginning. This video comes in 34 different languages. It's probably more by now, so that shouldn't be a barrier. And it gives so many visuals that really speak to the different moms on how to adjust babies so that they can get a deeper latch and get their pain to go away. Tell her that her breast pain should be getting better, not worse. Often small tweaks make a big difference, and we want her to be able to recognize when she needs to call and get more help and not just keep trying to suffer through the pain. She can always call us after she's discharged for more specific tips or for an outpatient consult too. Nipple pain is an indicator that the latch is shallow. Remember, the number one reason by far why there's nipple pain is because there was a shallow latch. Maybe it's a consistent shallow latch. Maybe it was a one-time shallow latch. But if the latch is shallow, baby may not be transferring enough milk. So we want her to be able to recognize that her nipple pain is a tool to look into something more. If she continues to latch shallowly and just deal with the pain, she might end up having a low supply, because throughout the first 2 weeks when her body was creating the supply it needed for her baby wasn't transferring enough milk. And she may not know this or realize this until 2 weeks or 3 weeks. So that's why we really need to use nipple pain as an assessment tool to us to say, ooh, something might be off here. Let's dig into it. Let's make sure this baby is latching deeply and transferring enough milk. So we have multiple reasons why we want someone with nipple pain to be evaluated and to know what they need to look for and when they should call, and to encourage them to call for more help. All right, jump on over to globalhealthmedia.org and watch the video, What to Do About Nipple Pain. And then stay tuned for a video on tongue ties, which will dig into a little bit more about that smaller percentage of people with nipple pain where the latch is not solving it. Thanks for watching.